There's been a lot of talk about this latest change in UK OSCE.
This 2025 updates is all about refining the exam. So in API, they have removed two scenarios from the API stations.
What about infection control techniques?
The clean hand, dirty hand approach, the candidates do not need to verbalize it to the assessor.
Are there any changes in oxygen administration stations?
Where students are getting scenarios with nasal cannula and venturi mask.
Hello everyone. This video is for all the aspiring nurses who wants to go to UK and start a successful career. Some of you might heard about the latest UK NMC OSCE update. In this video, we are going to discuss about that topic. So today, in this video, I am here with Nayana, who is the director of Envertiz Academy, who is going to give the detailed idea about latest OSCE update. So Nayana, welcome to this video.
Thank you.
So my first question is regarding the update itself. There's been a lot of talk about this latest change in UK OSCE. So what's the big picture? So why is this update here?
So the NMC reviews the OSCE regularly to make sure it reflects the current clinical practices. This 2025 updates is all about refining the exam, like removing old practices, refining the marking criteria, and making sure the nurses are assessed exactly on what they are practicing in the real life scenarios.
So now let's talk about API stations. What's new there?
So in API, they have removed two scenarios from the API stations. Those are asthma and anxiety and depression. So that means the candidates right now are preparing for 10 scenarios instead of 12, which was there previously. So this makes sure that there is less, reduction in preparation as well as there is more focused studying for examination.
Okay, now let's move to clinical skills. Are there any major changes?
Yes, there are some notable changes. Firstly, two stations, in-hospital resuscitation and nasopharyngeal suctioning. They were removed in the previous cycle. They are still excluded. So that means the skill stations stand at the count of 20. Okay. Notably, in IM injection, that is your intramuscular skill station, there are some small changes like gloves and apron are not a part according to the marking criteria. But still, we encourage our candidates to use it as good practice. Also, a very big warning regarding the medication dose. Many candidates are assuming that it's 1 mg per 1 ml as they are practicing. Right. Please do not do that. According to new updates, there have been changes in the dosages and it can vary according from case to case. So they have to read the prescription chart carefully before they administer IM injection.
What about infection control techniques like clean hand, dirty hand method? Is that still relevant?
Yes, that's still relevant, but the approach has been modified a little. The clean hand, dirty hand approach, the candidates do not need to verbalize it to the assessor, but it is still relevant in the practice where they are doing it. They still have to do it. It's just they don't have to tell the assessor, this is my clean hand and dirty hand, but they will do the practice. They will do it accordingly.
Are there any changes in oxygen administration stations?
There is no change in the station as such, but we have heard there are many increasing number of cases where students are getting scenarios with nasal cannula and venturi mask. So candidates get very confused because it's very new to them. They have been practicing with rebreather masks and they're getting venturi masks and nasal cannula. So to avoid that, just one small tip to them. When they get venturi mask, look at the nozzle. Right. The flow rate is already mentioned in it. Don't get confused with the different colors that is being given to you. Just look at the flow rate, what is mentioned in the nozzle, and then you can do your practice accordingly. It's just all about, exemplifying what you know about your clinical practices and making sure that you're practicing it in your exam.
Now let's talk about evidence-based practice topics. What's new over there?
So we had 14 scenarios in EBP station, out of which 2 scenarios. One is cranberry juice and UTI, and second is autism spectrum disorder. These 2 scenarios have been removed. That leaves us with 12 stations for EBP. And make sure that students should revise the topics that they are practicing. They should not go by the old marking criteria and they should revise the exact topic which is coming for their exam.
How about professional values? Any cuts there?
Yes, same as an evidence-based station, our professional value station also had 15 topics, out of which 4 topics, that is confidentiality, concealment of bed status, professional confrontation, and false representation. These 4 topics have been removed. This is to ensure that there is a streamlining happening there between all the assessment criteria across all the fields of nursing.
Any other updates we should know about? Maybe things that don't show up on the marking criteria, but still matters?
Yes, definitely. There are some small changes happening in many stations. Like for example, in administration of suppository station, the use of incontinence pad is no longer required according to the marking criteria. But again, we encourage the candidates to use it as a good practice. And same goes for the use of toiletries. The candidates need not verbalize it, it's just understood. They won't fail, but then again, it's a good practice if they do verbalize it. And gloves and apron should be used only where it is clinically relevant. So avoid overusing them just for the sake of it. And lastly, communication language expectations have been refined. Make sure whenever you're speaking to the patient, it's clear, it's concise, and it is patient-centered.
So, Nana, this is a very useful information. Thank you so much. Now it's time for you to talk to the candidates. Would you like to share some input to them?
Yes. My advice is to keep your preparation according to the updated content. Use the revised list of scenarios, skills, and equipments. Remember, it's not just about passing an examination, but also becoming a safe and competent nurse who is ready to deliver the care. We at our OSCE centers in Kochi, Aberdeen, and Oxford make sure our curriculum is updated according to the latest guidelines. So if you want to know more about the OSCE and you want to practice with us, please do contact us.